Hello everyone. So today's presentation is about the topic setting up the cath lab for a diagnostic study. So introduction. A cardiac catheterization laboratory is a specialized unit where minimally invasive diagnostic and interventional cardiac procedures are performed under fluoroscopic guidance. So, cath lab is a place where we do small interventional diagnostic procedures like coronary angiogram, angioplasty, balloon valvuloplasty, and a few other procedures too. So, among these, diagnostic coronary angiography remains one of the most frequently performed studies to visualize coronary arteries, blocked arteries, and also to access the cardiac functions. Proper laboratory preparation is essential before any diagnostic study to ensure patient safety, image accuracy, asepsis, and procedural efficiency. This preparation involves readiness of the physical environment, instruments, monitoring systems, and team coordination. So, in this presentation, we are going to see how we are going to prepare the cath lab before any procedure. So, first of all, the cath lab environment, layout and structure. So, cath lab typically it consists of a procedure room where the diagnostic study is going to be happen, and the next is the control room. It is a place where the image acquisition and recording are managed. The third one is the scrub room and sterile store. It is for the preparation of the staff and also to store the sterile supplies. The fourth one is the recovery room. It is for the post procedural monitoring. Next is the environmental control. So, how the cath lab environment should be? It should have the temperature of nearly 20 to 22 degrees Celsius, and the humidity should be 40 to 60 percentage. The air quality should be laminar airflow with HEPA filters. Next is the lighting. It should have adjustable ceiling lights with shadow-free focus. The last one is the flooring. It should have the anti-static and seamless vinyl to prevent dust accumulation. Next, equipment preparation. How we will prepare the equipments for the procedure. The first one is the imaging system. We have to power on and calibrate the X-ray machine. So X-ray fluoroscopic unit should be set on and it should be calibrated. The next one is the CM. We have to check the CM whether it's moments or okay, is it normal? And next we have to check the collimation and also the image resolution. And we have to check whether the lead aprons, thyroid shields, and radiation monitoring badges are there with the doctors and nurses, those who are performing the procedure. The next is the hemodynamic monitoring system. We have to see whether the ECG leads are placed properly and the BP cuff, and also we have to see the pulse oximeter, which is the oxygen saturation sensor. And then we have to check whether the transducer is zeroed before the procedure. If it is not zeroed, it will give some wrong calculation during the procedure. So we have to check it. And finally, we have to see proper functioning of recording software. Next is the power injector. If a procedure need this power injector, we have to fill the power injector with the sterile contrast media. The next we have to test flow rate and ensure no air bubbles remain in the syringe. Confirm correct settings for diagnostic injection pressure and volume. Catheters and accessories. So next we have to prepare the catheters. Usually we use catheters like Judkins left, Judkins right pigtail catheters, and we also use Amplex right and Amplex left catheters too. The next is the guide wires, manifold, three-way stopcocks, hemostatic valves. Then we use syringes like 10 ml, 20 ml syringes, contrast, heparinized saline, and sterile drapes. Next is the patient preparation. So before the procedure, that is before taking the patient inside the cath lab We have to check whether the patient is having any medical history or any allergic reaction to the contrast media or anesthesia, things like that, especially the iodine, because the contrast media contain the iodine property. And the second one is the baseline test. We have to test the ECG, renal function, coagulation profile, and hemoglobin. The third one is the informed consent. We have to explain the procedure, its risk and benefits for the patient, and we have to get a legally consent from the patient before the procedure. And next is the pre-procedure instruction. We have to give a few instruction to the patients before the procedures, like stay them uh, fasting for 4 to 6 hours before the procedure, and ask them to remove their jewelry, dentures, or any metal objects they have in their body, and shave and disinfect access site. Usually we use the radial and femoral site. And the next is the maintain IV line for medication and contrast delivery. Then positioning and monitoring. So after taking the patient inside the cath lab, we ask the patient to lie supine on the angiographic table. Then we need to place the ECG leads, PP cuff, and pulse oximeter to the patient. Then if the patient need any oxygen cannula, we have to provide that too. Then sterile draping performed after thorough cleaning with povidone or betadine also. The next is the sterilization and aseptic techniques. So first we have to sterilize the instruments, and also the staff or the person who is doing the procedure should be sterile. So first for the instrument, reusable instruments are autoclaved at 121 degrees Celsius for 15 to 20 minutes. Disposable catheter, it comes pre-sterilized and opened only before use. The next is about the staff preparation. They should wash their hands thoroughly. So strict hand washing and surgical scrub should be up the elbow. The next is to wear sterile gown with double gloves, mask, and caps. Maintain a sterile field around the patient at all time. Next is how we set up the field. So we should arrange the sterile drapes, trolley, and equipments that we usually use, so that there will not be any confusion. The next is to use sterile saline for catheter flushing. Next, avoid touching non-sterile surfaces while you are scrubbed. So next is the radiation safety. So we have to see the radiation safety for the patients as well as the staff. So for the staff, usually they are provided with the lead aprons, tire collars, and lead glass sheets. Then second one is the TLD badge. Usually every staff is given a TLD badge, and they can change it once in a month or once in 3 months. So they are given a TLD badge. So before the procedure, they are asked to keep the TLD badges with them. The next is limit fluoroscopic time and use proper collimation. So you have to reduce the fluoroscopic time according to the procedure time. The next is for the patients. So use lowest possible radiation dose for clear imaging. Employ pulsed fluoroscopy and automatic dose control. Emergency preparation. So usually cath lab has some emergency supplies like defibrillator, crash cart, emergency drugs like adrenaline, atropine, dopamine, temporary pacemaker, and also oxygen and suction units. After the procedure, we have to record the patient's the details, amount of contrast that we used, amount of radiation dose. Then we have to document the findings, complication, and also the image in digital storage. Then we have to clean and disinfect the table and floor once the procedure is done. We have to dispose the sharp and used catheters in biohazard containers, and also send reusable tools for sterilization. So this is how we set up the cath lab for each and every procedures. Thank you.